that was another part of it. As a full-time working mom, feeling like I don't have time to take care of me, and particularly around nutrition kinds of issues. The other thing I would say is I love to eat. I love food. It's very soothing for me after a long day. For me, there's...
Hey there, this is Dr. Pepper, and this is our show, Dr. Pepper Really, because that's what people would say when they first meet me in the office. And we're going to be delving into a very popular subject today. We're going to be talking about Ozempic, and we're fortunate to have Susie with us today, who is just beginning her Ozempic journey. And we would like to have her come back periodically to give us a heads up on how she's doing and her experiences and all that stuff that people would like to know ahead of time if they anticipate that they might want to try this, which has really taken over the public imagination. So good morning, Susie. How are you doing?
Good morning, Dr. Pepper. Lovely to be here.
So one thing that people would probably like to know is you are a nurse. Maybe you could just explain a little bit about what it is you do. A nurse practitioner.
Sure. Yeah. I am a nurse practitioner, and the field that I specialize in has to do with working with folks with both intellectual disabilities and brain injury. I also run a clinic in conjunction with a psychiatrist to work with psychiatric issues with that population of folks that we support.
And you've been doing that for a long time, right?
Very long time. A very long time. Right. Since probably the early 80s. So it's been a while.
Wow. So today, you are a caretaker. And in this case, we're looking at how you take care of yourself in terms of the weight loss issue. So I imagine you've done a few things in the past in regards to trying to lose weight. Maybe you could tell us a little bit about that.
I'd be glad to. And interesting that you say I'm a caretaker. Caretakers, as most people know, are notorious for being really good at caring for other people and not so good at caring for themselves. And I think that that's really relevant when it comes to weight issues in terms of a long past of struggling with weight. Things like, well, I had to stay late at work because I just couldn't leave the person I was caring for. So why not stop and pick up fast food on the way home? I don't have time to go home and stop and make a salad and, eat the healthy vegetables and the lean protein and all that. Many of us know what we should be doing. It's hard to fit it in. And caretaking is just a part of it. I'm also a mom, and that was another part of it. As a full-time working mom, feeling like I don't have time to take care of me, and particularly around nutrition kinds of issues. The other thing I would say is I love to eat. I love food. It's very soothing for me after a long day. No. For me, there is nothing better than once the kids were in bed, this goes way back, sitting down, putting on TV and having a piece of cake. That's what would be relaxing and make me feel good. It is a journey. I'm very excited to be on this journey. In the past, I have tried things like food that you order by mail, because that felt like something that would be doable. A big thing would come in the mail. You put it all in the freezer. You just heat it up when you're done. That's it. With that, I found that was helpful as long as you did it. The food was okay, not delicious. You go out with a friend for coffee, and really you still want to get a muffin with your coffee. But that was something that did work. If you tried it, it was trying to sustain it. I've tried some of the online things and I've also tried traditional things where you would go for a meeting and you count points and all of that. I have not had great luck with any of them.
Did you succeed at any of those?
For the short term.
Were you able to succeed?
Yeah. Yes, for the short term. I could lose 20 pounds, but 3 months later, they would be back because it was the maintaining it that I found very difficult.
And why would you stop doing it? Like if you were counting points, Like, what kind of things made it difficult and, you decided, well, I've had enough of this?
I think it's a combination of things. It would be number one, making sure I had what I needed in the house. And that seems very simple. You just go to the grocery store, shop the perimeter, and do all that.
Right.
I'd be tempted in the cookie aisle. The other big part of it was I would do a lot of takeout food, being very busy. And that I know people have been very successful doing that with points. I was not. And the other thing is the psychological part of food being a reward and having a craving for carbohydrates. That's my go-to. So, for example, in that situation, that's why over time it didn't work. Plus, I got bored.
Yeah. It gets boring to eat the same old thing all the time. And you miss your old
Right.
friends, right? Your coffee cake or what have you.
Absolutely.
Right? And also, I guess if you reach a goal, right? You reached, you lost 20 pounds. Maybe you felt, hey, good enough. Is that part of it?
I would have to say not so much because I need to lose more than 20 pounds. So after I didn't do it, I would kind of be really chastising myself, saying, what's wrong with you? You tried this. Why are you undoing what you did? Why can't you keep going? Unfortunately, the more I would do that, the more I would feel upset with myself. And as you call it, my friend, the coffee cake would make me feel better. Only for the 3 minutes it took to eat it, but it would make me feel better.
Right. Uh-huh. So when did you decide on Ozempic?
Over the years, being overweight takes a toll. What's happened in recent years is I've been blessed with grandchildren and want to have the energy to chase after them and play with them and do things with them. I do it, but I'd like to do a lot more with a lot more energy. So after 5 minutes of pushing on the swings or running around the playground, I'm not the one sitting on a bench. Also, what's happened medically is that my cholesterol started going up, and I do take cholesterol medication. And the other thing that really precipitated this was blood sugar going up little by little. It wasn't precipitous. It was over a few years that my A1C, which, as people know, measures your blood sugar over a period of about 3 months, was sort of creeping up. Right. And over the last year, creeping up to the point of being on the very edge of being officially diabetic. And as that was happening, Ozempic was coming into the limelight, and I was reading more about it, seeing more about it.
So did social media have any influence on you, seeing what other people were putting out there about their experience?
Some of it, yes, and some of it, no. The commercials on TV make it sound like the minute you take Ozempic, a big party starts. And I know better that a big party wasn't going to start. When I read about a lot of celebrities using it strictly for weight loss, it actually had a negative connotation. I don't want to be sort of in that world where you're using potentially very serious medication strictly to, quote, look good, unquote. But yes, reading about people's success with it absolutely had a positive effect and made me think this could be a good thing. So, also, being a nurse, I started reading about studies that were done that would also focus on the good parts and the potentially risky parts of taking Ozempic. So I looked at it clinically as well.
And so did you visit a doctor and explain this to them? How did you get your start?
I did, and I'm excited. I was seen by my PCP or NP over time. That's where I get my primary care. And the last time I saw the NP and we were talking, I brought up the Ozempic with her. And to my surprise, she said, you know what, you might be a very good candidate. Based on your weight, based on your lab results about diabetes, I'm going to refer you to an endocrinologist. And I couldn't get an appointment for 3 months. But during that time, I continued sort of getting pumped up. And I saw the endocrinologist about 3.5 weeks ago.
And how did that go?
It went great. I was so excited. And she looked at all my labs, which were up to date. And she said she thought I would be a very good candidate as well, that I'm motivated, that from a medical point of view, she thought I was somebody between my being overweight, my motivation, and my medical status, that I could potentially really benefit from taking the Ozempic. And she prescribed it right then and there. The other thing is that I know people have issues with insurance. And I am of an age where I'm on Medicare, and that is paying for the Ozempic. I copay, but it made it accessible to me as well.
And that's because I guess you were like a pre-diabetic, right? I mean,
Yeah, I
you
think
have a
that was probably
diagnosis.
one. Yes. And I think I
Because,
literally crossed over at one point into the qualifying.
Just, for general interest, it's important to know that, Ozempic, for example, is not approved yet just for weight loss, but
Right.
you can get approval if you have pre-diabetes, let's say, or at risk of diabetes. I'm not sure what the ongoing criteria are up to the minute, but this again is a medical treatment and needs to be managed as if it were, a true serious medical issue and requires a prescription by a qualified physician, or healthcare provider. So, have you gotten started yet?
I have. I went and picked it up. I saw the doctor and picked it up and gave myself my first injection a couple of days later. And again, the injection part.
You were telling me before that you didn't know how to inject, though, right? So you had to go to YouTube to refresh your memory about injection. Is that right?
I did. And as a nurse, of course, I've given injections many, many times. In my current job, it doesn't come up. And I thought, you know what? It can't hurt to sort of refresh yourself. So I did. I went to social media. I looked it up. I found what looked like a very sort of reasonable YouTube site that showed me how to do it. I watched it first, and then I did the injection. And in actuality, it's a piece of cake, so to speak. Bad analogy, but the cake part. But it was very easy.
Let me ask you this. If you had no medical background, how difficult do you think it will be for the average non-medical person to learn how to inject themselves properly?
I think that it's surprisingly easy. The needle is super skinny and super tiny, maybe an eighth of an inch long, maybe a 16th of an inch long, really thin. And you just put it onto your skin. I chose my abdomen to do it, and you rotate around. Right. And it literally sort of slides in. Use a little alcohol beforehand. It's a pen. So all you do is you dial up the dose that you have. You put it on your skin. Right. You push a button. You hold it in for 6 seconds after that, and you're done. I do think it would be very accessible.
Do you think that the physician has an obligation to show a new client who's going to use an injection what it's all about? I mean, as a physician, it seems to me that, that's should be part of the process, though. I'm just throwing that in as an editorial.
No, I think that's a really good point, Dr. Pepper. And I didn't mention that while I was in the office, she did show me how you do it and explained it all.
Okay, that's great.
She did. Mm-hmm. That visit lasted a good half hour, where she went over, maybe 45 minutes, went over all my history, my medical history, any other medication I might take that could interact, my current labs compared to my previous labs, my motivation, options for treatment, like as opposed to taking an oral med.
Like you had a very good experience. Yeah.
Very good. So, but I will tell you that when I did pretty much forget everything she said about the administration part. I needed to refresh myself.
Okay. Yeah, right. Very common. So how are you feeling?
So far, I'm feeling great. I'm happy that I'm doing this.
Okay.
I'm on, for the first month, you take a dose that is considered kind of subtherapeutic. In other words, not enough to really have an effect, but it sort of gets your body used to it. So I did that for 3 weeks. My fourth one will be this week, tomorrow actually. And then I start with the higher dose, which from what I understand is when I might see more weight loss and all that. I will say that maybe it's psychological because I'm realizing how much of weight related issues have to do with that as well. I do notice that I'm eating less. I'm not eating that coffee cake in the morning or at night since I started this.
Right. Mm-hmm.
I feel like if I can give myself an injection, if I can commit to this, if I can commit to a serious medication that I'm putting in my body, I've got to be all in. So
Great.
Have I given up completely everything and just shopping the perimeter? No. Have I made little changes? Yes. I feel fine. And I'll be interested to see what happens when I go to the higher dose.
Yeah, that's great. So that's what I'm hoping for the next time we can speak to you, that you'll be on a higher dose, that, you'll be well on your way, and then you can share with us your experiences, the physical aspects of it.
Mm-hmm.
And we'd like to keep track of you if you have time, and you can come back and we can chit chat and keep an eye on you from a distance.
I would love to do that. And I appreciate your input and your thoughts, and I really appreciate it. And I'm excited to be doing this.
Okay, great. All right, Susie. So take care, and we'll be circling back with you in, I guess, a few weeks.
Sounds
okay,
good.
Good luck.
Thank you. You too.
Bye.
Have a great day. Bye.
This is Dr. Gary Pepper. Thank you for listening to our podcast, Susie Starts Ozempic. And if you liked our episode, please put a like on it and share it with your friends and family so the channel can grow. We appreciate that. We strive to provide unbiased, useful information on health topics that are up to the minute. And certainly this area of injectables used for weight loss is one of those. Remember, though, that this is not for the purposes of healthcare advice or treatment, and that can only be provided by your healthcare professional. In the coming weeks, we hope to follow up with Susie on her healthcare journey to see how she's doing with her treatment and to learn the ups and downs that are almost inevitable in this kind of treatment. So please keep your eyes open for further developments at Metabolism 123, and we hope to see you then. And as always, remember, keep it real.